Okay, so what we're doing here is just having a quick feel to see where he's tight in his back. Feel quite a lot coming up through here. So I'm going to just warm him up a bit, have a feel of his legs. With him, warming him up may even involve a bit of elbow work. So sometimes alternating between my hands. Not full pressure or anything, just... What I do notice too is that his skin absorbs the oil quite quickly. So might use quite a bit of oil. This can be quite a nice move where it's just, again, more of a sort of warm-up move, kind of draining the kidneys a bit. It's the main move that we would probably do over the kidneys, although in shiatsu sometimes they do individual pressure points over the kidneys. But it just, again, warms him up, makes him, it's kind of relaxing. So when I'm doing an elbow move, I'm wanting to go quite slowly because I don't want to slide into his spine or into his shoulder blade. So you got a little couple clicks there out of his back just from doing that.
You can feel everything through your elbow there?
Yeah. Takes experience, just keeping on doing it and you'll feel. But if you want, you can feel with your thumbs first. Again, it's just paying attention. Again, not going too fast. If you go too fast and slide into his spine, it's not good.
So you're using the full point of your elbow there?
Yeah, but not all my body weight. It's because I've got quite a big elbow. It's not very pointy. So I'm not going to fit in between people's shoulder blades and spine without using more of the point of it. Plus it can get in there a bit deep because he's a big guy. He needs fairly deep just even as a warm-up. You can do like a sweep back if you like with your forearm. Not very effective for anything therapeutic, but kind of looks good and feels good.
If you bought a Ferrari though without any paint,
yeah,
it'd still be a Ferrari, but
yeah,
it wouldn't look as good.
That's right. That's right.
The paint is that's the part that everybody sees is the paint.
Yeah.
I don't see any paint.
He wants the engine. He wants a car that moves. Okay, so I'm picking up quite a lot of tension up through here. To me, that's saying his chest is tight. Again, he's not as tight here, he's tight here, and then it loosens off. Remember what I was saying when you see that? And notice how his back is a little bit arched as well. Okay, so I'll have a feel of his legs, but I'm already suspecting we need to work on them.
Any other muscles on his back other than the two either side of his spine when you start off?
And a little bit on these diagonal ones as well.
As it goes off.
His diagonal ones are, yeah, a little bit tight, but not too major, okay? Does anybody want to have a quick feel to see what we're feeling?
Diagonal turn here, that's right.
No, this way.
This way.
Yep, so you'll feel them that. By crossing over them, you'll feel them.
That was all right.
Yeah.
I knew my legs were just fully stretched on that, but as soon as you go under there,
Yeah.
it's just the same as what he just done then.
Yeah. It's tight.
So,
Yeah. Again, people don't often realize their chest is tight. Okay, so it's like, oh, but you know, again, so again, to me, we don't want to mess around too long on his back, but I will warm his legs up just for the sake of it. Don't know why, no real reason. Just to give him a little chance to get in, more to give him a chance to get into the massage before I get into his tight areas in the front. Also for me, just to have a feel of what's happening with his legs. So, quite interesting. I mean, have a feel of his calves. You'll feel they're quite tight. It's more the outer part. Now, he's tight all over. Like, he's got that general sense of, feel this leg, and you'll feel like a general sense of tightness through there.
Yeah.
It's like a solid.
Yeah.
It is solid.
He's all solid everywhere. Like, there's not a lot of kind of, like you trying to shake that. You've seen me shake a few legs before, and this one, like the whole thing just like nothing moves in his ankle. The whole thing just moves as one big board.
If that down there, is that going to go all the way down there?
Yep, that's right. And then into here,
Down there, all right.
right
okay.
into the toe, right along the edge.
So
of the
that's
toe.
a big toe thing, in a way.
It could be. It could also be from the front. Yeah.
If it was lower down, it would work.
Yeah, if it was totally lower down. Now, there's obviously some involvement in that because there is a little bit of tightness coming down even through here, and he does feel that pain in his lower back as well. The pain in the lower back is more probably coming from the outer part of his hip as well, quite possibly, which is quite tight. All right, and we know he's got a pain. When you got calves like this that are this tight, you can expect lower back pain, okay? So there's definitely tension coming up from his legs into his lower back. So I would say with him, my treatment plan is going to be, yeah, front and legs. His arms, not showing up here as being as bad, although it may be the inside of his arms. His thumbs could be leading up into here, causing that chest tension as well. But if you feel his arms and compare it to his legs, you'll see there's quite a big difference. They're more floppy, yeah. All right, so I'm not going to focus right now on his arms. His legs just seem a little bit like, again, a little bit overwhelming. I'm not looking forward to working on his feet right now. I want to warm myself up a bit before I got into them.
Say he was a push bike rider or somebody who had, how can you, like, because they get really tight and muscle calves, how would you determine the difference? Is it still should be some movement even though they're that muscular?
Yes.
There should still be.
Yeah.
It should
They
still
might
flop
be
around a bit.
Yeah. They might be tightening themselves up by what they do, but they're better off being loose.
So, but if you had someone who was like that,
Yep.
who had a problem, they should still flop around that, should they?
Yeah.
Okay.
Yeah, because otherwise the tightness, the activity they're doing could be causing muscle tightness as well as muscle strengthening.
Does that
But
have anything to do with like excess fluid in your legs or as well?
not usually this sort of thing here. This is tightness to me. Excess fluid in the legs would be like a swelling around the ankles.
What's that fitting edema or whatever it is?
Yeah, edema is it sinks. So it sinks the ankles. Yeah. So you'll find that with like a swollen type of area around the ankle. That's where you don't want to massage over. Swellings of the ankle you'll aggravate them. I've had it where I've had swelling in my ankle before, the one that I've had a few problems with over the years. And people massage it when it's a bit swollen and it doesn't feel good.
So it's not getting rid of any.
It's not getting rid of it, no. It may if you, I would massage above and below an area that's got a problem like that, but not over it. So you massage above it, below it, and see if you can then lose, and then lightly come through it and see if it moves and disperses.
Still roll the ankle, roll the foot. You know how you
Yeah, you can.
when
Yep,
they're swelling there?
yep, you can, gently.
Is that going to help? dislodge some of
It
that?
might, yeah,
And
definitely,
or
yep.
is it
It's
down
all
again?
going to help, like keeping that opening and circulation and fixing up. It's like with an injury, like if an area has been injured, like a strain or a sprain, right? It's injured, you don't want to work over it, but you would work below it and above it. And that will help the healing of that area.
That'll let that.
Yeah, it'll take some of the pressure that may have been leading to the injury. For example, sometimes when people are really tight, you know the old story, Humpty Dumpty, the harder they come, the harder they fall, right? So when somebody's really hard, they injure themselves really easily because they don't have that softness to move with something. You know, somebody gets bashed when they're hard, there's no flexibility there. Okay, so that could actually cause an injury. So by taking away some of that hardness, it'll also help repair it. It'll allow the blood to circulate into an area better. Yeah.
Is it the same for, like, if they have really, really bad lower back?
Yep.
Do you kind of just avoid actually being in that area?
You wouldn't, yeah, with lower back pain, it's the legs.
Right.
Almost always, yeah. Legs up to the hips that are causing it. So you would start at the feet, do the legs. See, with tight legs like what he's got, I'd expect lower back pain. You got lower back pain, don't you?
Yeah.
Yeah. His main problem area. It's not about going in and doing this. That might feel good for him, and it will temporarily relieve it a little bit, actually. Make it feel a bit better. You do that, but near the end. But to get rid of it, see, if I just did that, oh yeah, it feels a bit better, you know? back again within a day, or less. His problem is that his legs are so bloody tight.
So most lower back is leg.
Yeah.
So if you get that in our mind,
Yep.
someone, 'cause
Lower back
I
legs.
reckon 60% of people who go for massage have got a lower back problem.
A lot of them do, yeah.
Yeah. So the first thing we think of is
Legs. And here's an example. Lower back pain,